Greetings to the delegates and judges at the EBPOM World Congress 2022. My name is Amit Deshmukh. I'm one of the ST6 anesthetic registrars currently working at Cambridge University Hospitals. The poster I have presented summarizes my research project that I did during my academic year at the University Department of Anesthetics in Cambridge University Hospitals. Now, as we all know, all the patients that have an emergency laparotomy in the UK are registered in the NELA laparotomy audit. As a part of the audit process, we enter the relevant patient's details into the NELA website. Now, the NELA risk calculator gives us a predicted mortality and a morbidity score based on the details of the patients that we have entered. As practicing clinicians, we know that many other factors, apart from the ones that we have used to calculate the NELA score, can affect the patient's outcome. How busy a hospital is, or in other words, how stressed is the capacity of a hospital, is one such variable. The stress of a hospital's capacity can be potentially described by the factors that I've enumerated in the table 1 of my poster. Now we know that the NELA risk calculator or the NELA risk score, which is based on a logistical regression model, is a very well validated tool. We started our project with the idea of having the primary outcome of inclusion of the hospital stress parameters into the NELA risk model to see if its predictive capacity or its discriminative power improves. Our secondary objective was to find out an association between the capacity stress parameters and the length of stay of NELA patients. Using logistical regression, in the magic world of the programming language R, we built Cox and linear regression models, including the NELA parameters and our capacity stress parameters. As we had expected, the NELA risk model is a very robust one. Addition of our capacity stress parameters did not add to its discriminative or predictive power. Then we moved on to our secondary objective of determining if the capacity stress parameters affect the length of stay in any way. Our analysis showed that 2 of our capacity stress parameters, like mean missing news and Z-score median, had an association with the length of stay. In conclusion, I would like to say that the NELA mortality risk model is a very robust one, and that there is still more scope for research in predictive modeling for length of stay with capacity stress parameters. Thank you.